when we look at SNAP, we got about 41 million people right now. I think it's about 13, 14% of the country who rely on that to be able to get as close as they possibly can to having a balanced meal, to being able to have enough nutrition in their bodies to be able to survive, right? So when I see that particular action with that clip, for me, that talks about a survival mentality. And we've got too many politicians who are willing to go to the lowest possible denominator, and that's where they operate from. Where people who are in community are tired of just surviving. A great person once said, "I'm sick and tired of being sick and tired." And we have to change the paradigm. The paradigm for politicians, for everyone who votes, has to be on thriving. We should demand from our politicians the types of things that we need to be able to not just deal with the basic amenities, right? Basic amenities, air, clean air, clean water, access to food, access to housing. But you can't even get these politicians to do those types of things. And it doesn't matter if they're Democrats or Republicans or independents. I throw everybody in there until you show me something different, until you show me that you're actually willing to stand up and fight. And that's what people are looking for. And that's why they're so disconnected from the political systems, because very few people are willing to fight. And when the folks do fight, often they are attacked by so many different individuals and corporations and big PACs and all this other type of stuff that they eventually get wore down, or they find a way to vote those folks out because they were actually the ones that are willing to stand up. So again, no more of this performative stuff, no more bumper sticker language. If you can't take what you did back home, actually sit down on somebody's kitchen or on their back porch and show them how their life is going to be better, then you're wasting people's time. And when you're wasting people's time, you're putting their future in danger, and you are literally, in this particular moment, putting people's life, on life support, and then turning the electricity off because people can't afford it to keep you alive.
I believe in data that shows you exactly what's going on, and people need to actually have numbers and not generic. So this is what Senator Elizabeth Warren posted on her social media account. She says, how many people will lose health care if in your state under Trump's big, beautiful bill? Y'all, here are the numbers right here, okay? Senator Tommy Tuberville, remember he talked about the rats and federal. Well, guess what? Alabama will lose 219,803 people will lose health care in Alabama. Alaska, 39,989. Arizona, 365,984. Arkansas, 158,745. Hello, Sarah Huckabee, Trump's lying White House press secretary. That's your state. California, 2,368,466 people. Colorado, 240,953. Connecticut, 86,580. Delaware, 54,957. Florida, 1,936,421. How about that, Governor Ron DeSantis? Georgia, 651,540. How about that, Governor Brian Kemp? Hawaii, 62,483. Idaho, 72,815. Illinois, 535,849. Indiana, red state, 267,996. Iowa, red state, 113,979. Kansas, red state, 92,937. Kentucky, Democratic governor, red state, 184,526. Louisiana, MAGA Governor Jeff Landry, red state, 267,550. Maine, 61,488. Maryland, 245,929. Massachusetts, 326,262. Michigan, 453,101. Minnesota, 173,268. Mississippi, 153,910. Missouri, 265,298. Mississippi, Missouri, two red states. Montana, red state, 55,981. Nebraska, red state, 78,275. Then we go to the next one. We go to Nevada, 114,500. New Hampshire, 46,388. New Jersey, 363,330. New Mexico, 111,997. New York, 1,019,121. North Carolina, y'all voted for Trump, 651,982. North Dakota, red state, 24,488. Ohio, red state, 489,815. Oklahoma, red state, 211,794. Oregon, 198,089. Pennsylvania, y'all voted for Trump, 483,868. Rhode Island, 47,359. South Carolina, red state, 285,857. South Dakota, red state, 33,838. Tennessee, red state, 310,056. Texas, red state, 1,671,965 people. Utah, red state, 188,494. Vermont, 35,242. Virginia, Republican governor, 322,984. Washington state, 328,695. West Virginia, red state, 82,225. Wisconsin, y'all voted for Trump, 276,175. Wyoming, red state, 20,407. That's 17 million lives Republicans are putting at risk. How in the world can we talk about this country having the greatest healthcare system in the world, and we literally are taking healthcare from people because we want to give corporations more tax breaks? How can we say how great we are, how wonderful we are, when we literally are saying to people who make $200,000 to $500,000, oh, we're going to hook you up with more tax breaks? I need people to understand when we talk about how much people truly make in this country. Because I think a lot of people are absolutely confused when we talk about how much people make. And people walk around in this sort of Instagram world where they think, oh my God, I mean, I think just the average person walking around is making $100,000. Y'all see all them videos, folks talking about who they should date. Like, I ain't dating no man unless he making $100,000, $200,000, $300,000. Well, let me help y'all out. This is according to the United States Census. In 2023, this says income in the United States, all right? This is the United States Census. This is the highlights right here. The real median household income in the United States is $80,610. That's the median household income, means mother, father, and likely 2 kids. That's the median household income. It increased by 5.4% for white households. It increased 5.7% for non-Hispanic white households. There was no significant change in the median incomes for Black, Asian, and Hispanic households. Y'all, $80,610. That means if you ain't making $200,000 to $500,000, that tax break don't impact you. Oh, by the way, the SALT deduction, that's for homeowners. Black home ownership has never been 50%. So if you renting, you don't get that. You don't get that. See, these are the real numbers I'm talking about, Randy, when we start talking about these bills and how and who they impact and regular ordinary people. So I'm not interested in having a whole bunch of talking heads just sitting here chattering. No, this is real life. We already see people having to spend so much money on food and gas. I'm going to play a clip in a second. Trump was lying today about how all these things have dropped, still lying. And they want to sit here and say, yo, if you are making 200, 300, and 400, and 500,000, ooh, America's great for you. And while they wearing red hats, everybody else should be wearing black hats, because it's going to be thunderstorm, cloudy days in their houses.
Right. You know, we seem to like reality TV so much. We need to get real about our own lives. I agree with you that social media has warped our perception of how most people are living and made us feel as if we are, should be living a certain way. The reality of it is that most of us are living paycheck to paycheck. The reality of it is when we say, oh, we'd only date somebody that's making $100,000, most people are not making $100,000. The reality of the whole thing is that we are struggling, and something like this bill that affects every aspect of our lives. You talk about healthcare. That is the biggest way. That's the number one way that people end up filing bankruptcy. I always point out to people, you never hear about a important, like a senator, you never hear anybody in the government or a president that dies young. And why is it? It's because they have top of the line healthcare. They are looked at and checked out all of the time. When we talk about our history and how we die young, it's because we're not receiving the same level of care. And now it's going to get worse. We just went through a pandemic where people couldn't get the services that they needed. Can you imagine now if you can't even get to a hospital in time to help your loved one? Right? We need to get very real about what's happening. And what has been someone needs to be do a psychological study on white people thinking that privilege equals money. You can have white privilege, and you do, right? If you live in America, there's certain that your race does not cause you certain issues, but it does not mean that you have more money. And so you have these broke white people who are making at or below the poverty level, and they keep voting against themselves because you have a president who has divided the company and made these people think that white is one way and everybody else is bad and poor and broke and criminals and illegals and all the words that he uses all of the time, and makes them think because they're white, they're right. And they're going to be, no, they're going to be white and sick, white and broke, white and dying. Like the numbers you just went through of how it's going to affect every single state, is real, and it's going to impact not just Black people. Because I think just like they voted for this man in, is why they continue to cling on to him, is because they have this idea that these cuts only will affect Black people, because that is the perception that we've always given about Black people, that we are the ones who are broke and struggle and have issues. And that is not the case. They are going to, sadly, I don't even want this, they are going to fuck around, and they are going to they have fucked around, and they're going to find out. And it's going to be a bad wake-up call for the majority of Americans, because even those people who are making more money, this will impact them as well. It's sad. It really is sad. And people need, they hate the word woke, but some of these people need to wake up.
I mean, Joe, when you start walking through this, and again, you want things done that are going to be beneficial and help people. That's what you want to do. What you don't want is to sit here and deal with this thing. This guy sit here. This is the kind of thing I'm talking about. Give me a second. When you talk about broken systems in this country, I just saw this tweet. Give me 1 second. Let me pull this up for y'all. Now you tell me how regular, ordinary person is supposed to deal with this here. This man, Matt Van Swole, just posted, in March, my wife went to the hospital for stomach pain. They did a CT scan of her abdomen that came back negative. The bill was $9,117.42. Now, first of all, he goes, but apparently if you're an illegal alien, this is free. The system is broken. Well, Matt, you don't know what the hell you're talking about. Because see, what Matt doesn't see, that's one of these MAGA folk. That's one of these MAGA folk. Right. See, but I want people to understand why I'm exposing this. See, Matt, first of all, this was also hilarious. I'm sitting here looking at his timeline. Y'all can go ahead and pull it. He's a former nuclear scientist for the U.S. Department of Energy, ex-photographer for Apple, United Airlines, and Hyatt. Okay, so all Matt is doing is tweeting about free health care for illegal aliens, all this sort of stuff. And look at this here. Look at this. Then he's criticizing a pride parade. He's sitting called Tom Tillis is the word. Now here's what's hilarious. He's ripping. Look at this here. Tom Tillis is the worst senator. Dude barely visited us in Western North Carolina after Hurricane Helene. You do know Trump refused y'all more resources for the hurricane. He hasn't done jack shit for recovery of the area. Tom Tillis has to go. But you MAGA and you supported Trump, who ain't sending y'all no money. He goes, I'm new to the conservative movement, but have the GOP always been this lazy and ineffective? So y'all, he's laying all this thing out. He's posting about how great ICE is. Let me explain something to y'all right now. To all the people out there who don't understand how things work in this country, I'm just going to give you an example that you may not be familiar with, and that is this here. In the United States of America, public hospitals are required to treat people. I need everybody listening to me right now. I need you to hear what I'm saying. When you go to a public hospital, y'all, there are two hospitals in America. There are public hospitals and there are private hospitals. A lot of the public hospitals are actually nonprofits. I grew up in Houston, Herman. You have two, Herman Hospital, public. You got Methodist Hospital, okay? All right, so if you're in Houston and you are having a murder situation and you roll up to Herman Hospital, they are required by law to treat you. Whether you are undocumented, whether you are an American citizen, and here's the deal, they're gonna send you a bill. Now guess what? Matt don't understand that CT scan for his wife, it's gonna be the same for an undocumented worker or for an American citizen. You're gonna get the same $9,000 bill, Matt. That's what you're gonna get, Matt. And the private hospital, Matt, can refuse to treat somebody. They literally, sir, do you have health care? No, I don't. I'm sorry, you don't have health insurance? Yeah, we can't see you. They don't have to treat you. So when Matt's bemoaning the same healthcare system, see, that's why I love showing these MAGA people, Mustafa, because Matt is talking about how he's now a conservative, yet the people who want to get rid of $35 for insulin are the Republicans. When you go into a public hospital, if you can't afford the bill, you know who pays that? Taxpayers. Taxpayers. So one of the reasons you've had the Affordable Care Act is that people then had health insurance. It dramatically decreased the number of people who didn't have health insurance. So if I want all y'all conservatives and liberals and progressives and fiscal hawks to all understand that right now, American taxpayers, based upon our county health systems, they foot the bill when people don't have health care and they show up at public hospitals. It is stunning to me, Mustafa, how many people don't understand that basic fact that's costing the same taxpayers billions of dollars. So if people actually had health care, it wouldn't be costing the taxpayers. You on me?
I think the other part,
There you go. Come on, guys.
Yeah, I was just
Go ahead.
I was just going to say you hit it on the head. I think the other part of the context for folks is that, most folks don't understand we've got 129 million people in this country who have at least one chronic disease. Now, that's not Mustafa who's saying that. That's the CDC who actually shared that number. And when we look at you've got, I forget what the number is now, it's about 60% of bankruptcies that also have medical debt. That's a part of pushing people into bankruptcies and all the parts that come out of that. So it just makes no sense to limit the amount of individuals in our country who have basic health care. To take that away means that if you know what the numbers are, then once again, more people are going to die. But not only are more people going to die, there are going to be these ripple effects of you not having health care because you're making other types of decisions that are going to create additional stressors. I believe Randy brought into our conversation a little bit about the mental health aspect as well. So it's not only cruel, it just doesn't make economic sense for you to limit the amount of people who actually have access to health care. It makes the country weaker. You end up having a workforce that is sicker. That means that we cannot compete on an international level in the way that we need to. It means that, you have parents who are sicker, so they can't spend the time that's necessary with their children. So there are all of these ripple effects when you don't have the strong healthcare infrastructure in place. And healthcare infrastructure is making sure that you have the health insurance that people need, making sure that they have access and affordability to healthcare facilities.
Yep.
All of these things are critically important.
I'm trying to give folks this here. I want to show you this real quick. I'm trying to find a more recent number, but this is this was published April 6, 2021, and it shows that the uncompensated care costs for the nation's uninsured average $42.4 billion per year in the 2015 to 2017 time period. Now, guess what? That's after the Affordable Care Act. Before the Affordable Care Act, it was $62.8 billion a year. So the Affordable Care Act cut by $20 billion American taxpayers were spending for uncompensated care costs. Y'all, that means county people, taxpayers are paying that amount of money. So if more people have health care in America, it's going to cost taxpayers less dollars because they don't have to be paying the uncompensated care.
Hello, I'm Isaac Hayes III, founder and CEO of Fanbase. Listen to what I'm about to tell you. The window to invest in Fanbase is closing. We've raised over $10.6 million of our $17 million goal. That means there's room for less than 6,370 people to invest in Fanbase for the average amount. The minimum to invest in Fanbase right now is $399. That makes you an owner in Fanbase today. Go to startengine.com/fanbase to invest. Why? Because current social apps have taken advantage of users for far too long, with content suppression, shadow banning, harmful racist content, and no real tools for monetization and equity. Fanbase has over 1.4 million users and counting, allowing anyone to reach all their following and monetize their content from day one. Social media is the new TV, and whoever owns the apps that distribute that content have the opportunity to own potential billion-dollar companies. While big platforms with uncertain futures are failing to serve their users, Fanbase is stepping up to fill the gap. Don't wait until it's too late. Invest now, invest for yourself and your future. Go to startengine.com/fanbase and own the next generation of social media.